Spending more money to treat and prevent the spread of AIDS, malaria, and other diseases around the world is the main recommendation of the report released by the Institute of Medicine. It says the U.S. should double its annual multi-billion-dollar global health programs by 2012. Dr. Ruth Levine of the Center for Global Development was on the board that released the report.
We're recommending a doubling of the global health commitments from $7.5 billion to $15 billion, which sounds like a lot, but it actually would still be a drop in the bucket in terms of responding to the needs.
Dr. Levine says in the past 5 years, the U.S. contribution to global health has increased markedly, especially for the treatment of AIDS. The funding has bought life-saving drugs and led to HIV prevention strategies that have benefited millions of people. Dr. Levine says the incoming Obama administration must continue to support these existing global health programs.
The U.S. already is a leader, and so what we're saying is it can't shrink from that obligation that it's basically we have established for ourselves.
However, the report says the U.S. should allocate more money to fighting chronic diseases, such as heart disease and cancer. This has been a neglected area, but it accounts for half of all deaths in developing countries.
That's where, you see our health problems being really similar in many ways to the health problems that are emerging in developing countries. And so we have a lot to offer in terms of treatments, in terms of knowledge about how to deal with, diabetes, heart disease, cancer.
Dr. Levine says meeting these global health goals will not be easy, noting that in times of financial crisis, foreign aid usually drops. Catherine Cannon, VOA News, Washington.